the whole point about incapacity, because my whole career, I've spent my whole life trying to be the best darn nurse that I can be, and an excellent nurse. And I've been fortunate. I've gotten an award in excellence in direct patient care. I've got a leadership nomination. I've got team nominations for excellence in nursing. So it really hurt. And I think the biggest part was that since I was 19 years old, I've been dealing with this bipolar and dealing with it pretty effectively. And the doctor had told me that I could come back to work, and I was kind of being stopped and said, no, you can't come back to work until you sign this. We have to have these meetings, and until you sign this memorandum of agreement and all of this. This needs to be addressed. People need to understand. Everybody needs to be aware, like the awareness piece, as opposed to me keeping it even inside me for so many years, not wanting to tell anybody at UH that I was bipolar. Now they'll know, and it's like, what's the big deal? Because really, it's like with anything, it's like cancer. Once you know that you have cancer, you can learn to deal with their treatment. But sometimes it's the part about not knowing what you're dealing with. And I know what I'm dealing with, but now this group will know what I've been dealing with. Probably the first and most important one, and one of the most important ones, is about communication. And communication with the individual, if you feel that if you have a concern about them, and going to them first instead of going to management. And if you've addressed it with the individual, then you go to the manager, and then if the manager doesn't, the manager then has a responsibility to come back to you. And then if you feel different about you've given your side or your understanding of the scenario, then there should be a joint meeting with that coordinator. The other thing I might recommend too, based on my experience, is that think about bringing an ONA rep. What I will say about Liz McIntyre is she was another one. Between ONA and Liz McIntyre, it's like she saved my life. And she saved my nursing life, which means more than anything to me. But I promised I wasn't going to cry, but who cares? But Liz McIntyre was, in my mind, my angel. And she came into my life when I was starting to get to the point where, do I need to give up? Do I need to accept this? Do I need to accept that this is part of my illness? And when I went to her and Mike and I sat in her office, and she said to me, Linda, I want to take you on this journey.